Hi, this is George Latimer, Westchester County Executive, and this is our afternoon update on the status of the Westchester impacts from the coronavirus outbreak. We moved this back from the usual 2 o'clock setting to accommodate those that want to see Governor Cuomo's update, which came on later today. And obviously, some of the issues that he's going to be dealing with are statewide in importance, and so they supersede those of us at the county level. But we have started here at 2:45, and we'll try to be brief and hopefully be substantive for those of you who are tuning in. We have members of the working press that are involved with us here, and they'll be asking questions through email. Joe Scamato, our Deputy Director of Communications, is with us here, along with Rosie Finizio and Blanca Lopez from our team. Questions will go to Joe, and they'll be directed to me after we have our general updated information. We're located here at the Westchester County Child Care Emergency Drop-In Center. And this is a facility that was created just within the context of this virus outbreak. Once the public schools were closed, the state required each of our local governments, in this case the county government, to put together a child care structure for those parents who are emergency first responders or otherwise essential employees, so that they can continue to perform their work and at the same time have their children cared for during the day and what would be otherwise school hours. And so we've created a system very much from scratch to accommodate that need. And we're here in one of the locations where that is happening. Rosie Finizio from our team has past experience in education for young children. And so she was the perfect person to work on this, along with Blanca Lopez. And so we're very happy to be based here to have this situation. This is coordinated by our office, along with the Department of Social Services. Children are able to participate in the online learning offered by their school while they're here at the child care program. We think that's a plus. We have 12 child care workers on staff, and we receive those individuals from the County Youth Bureau. We have a volunteer nurse, Laura Benson, from the Department of Health, who came out of retirement to help us. And she was one of the many individuals. I think we totaled over 100 nurses who had experience, who voluntarily decided to help the county in one function or another. The hours of this center are open from 9 a.m. to 5 p.m. from Monday to Friday. And this is child care to essential workers, as was mandated by the state under the directive of Governor Cuomo. We serve 2 meals per day plus 1 snack, and all staffs wear masks, practice social distancing. Everyone who comes into the facility must be masked and screened by our nurse. They do a little temperature check. I checked out fine. I'm very happy to hear that. And again, we're appreciative that Rosie has taken on the responsibilities of being the acting director of the facility. She has a master's degree in early education, as well as a permanent teaching certificate up through 6th grade. And so she really has done a great job in putting this together. The program has been extended here until Friday, June 26th. We await other decisions at the state level regarding mandated circumstances, and that will determine if it continues beyond that point. But this was an essential element to be put in place in order for Westchester County and every other place in the state to accommodate the fact that schools would be closed, and at the same time, first responders needed to have childcare established locations for them. So again, we're grateful to our team, and we're grateful to DSS, and we're grateful to our partners in getting this accomplished. We have no updated numbers today. We're still waiting for the state tracker to report. And just so you understand why we wait for numbers from another source, hospitals report directly to New York State the number of people that are hospitalized. The various testing facilities, whether it's the Glen Island facility, Westchester Medical Center, some of the smaller facilities that are now up and operative, they report their results to the state every day. And so as county officials, we try to contact, get information from the state, and then chop it up into the pieces that most of our viewers, listeners, or residents want to see it in. People want to know what's happening in their local town, city, or village, as well as what's happening in the county at large. In fact, in many ways, what matters more to people is what's happening in their local town, city, and village. I understand that, and we're comfortable trying to provide whatever we can. Under normal circumstances, we track the number of positive cases that have been tested for COVID. And then we come up with an active number of cases, which subtracts, that was 2 weeks ago. We've talked about that literally every single day that I've done these updates. A hospitalization rate is important. Not only is that, I think, a good example of how wide the spread is, but it also tells you a little bit about the depth of the spread, because people who test positive for COVID at a relatively small percentage, less than 12%, wind up being hospitalized for it. So that means 88% of the people are able to handle having contracted the infection, but it has not affected them to the point where they needed hospitalization. And so that, of course, has been good news. And then, of course, we track daily the number of fatalities. That number has been dropping dramatically night over night since the peak. That was the first week of April. If you've been watching these programs, again, it's the same thing said every day, but it continues a trend. And it's important to know that nothing has spiked, nothing has changed. Nothing has made us think that the steady decline that we've experienced over the last 3 weeks all of a sudden shows some new increase in infections. And we monitor this in light of the different policies we've had. We've had policies in the county government to open certain types of recreation that are within our authority. People have been concerned, is this going to advance the spread? Well, apparently not, based on the on the numbers that we see coming down. And our numbers at this point exclude what's happening inside nursing homes as very targeted areas. They report to the state as well, and it's a separate pool of numbers that we have to work off of. Working off of yesterday's numbers, it is also encouraging to note that we have tested over 115,000 people. Westchester is a county, we assume in the next census will show that we have 1 million people. So 115,000 tests represent 11.5% of the population of the county tested, far above what other jurisdictions of the state have been. And every day we're testing an additional 1,000, 2,000, 3,000 people, depending on how robust the testing is that day. So while we don't have any new statistics, the last statistics we show are active cases for the first time under 3,000 since the beginning of the infection, 2,985. Hospitalizations down to under 500 hospitalized, 479 from a peak of 1,200, actually 1,194 to be specific. And a death ratio where overnight deaths in the prior evening were 7 individuals. Every loss is a tragedy, is a personal impact to some people. We do not minimize human beings. We don't treat them as statistics. We report statistics because the state is tracking the numbers to show the trend line. If the number of deaths are decreasing as a percentage, that is good news. We hope for the day when it's 0 deaths and 0 deaths and 0 deaths. And as I've mentioned almost every day, that's why we've established a week ago the Ribbons of Remembrance at Lenoir Preserve down in Yonkers as a place to go and a way to honor those who've died. And frankly, just on a personal level, I think you cannot talk about this infection and all of the different policy issues that surround it. How do we handle daycare? How do we get personal protective equipment to necessary first responders? How do we protect our bus drivers? How do we start the process of reopening our economy? What is it going to look like when we reopen the economy? What are the phases? What's the economic impact of doing it? All of that are important public policy issues. But if you don't talk about the loss of life, if you neglect the human element, then you miss the whole reality of this. The whole reality of this is our nation and our world has been hit by a virus that has cost human lives in large number. We've never had as many deaths in a peacetime environment as we've had with this infection, going back, I guess, now to the period of time 100 years ago with the influenza epidemic of that day. And that makes you stop and pause that there were so many people who are alive that are no longer with us. And I think the lack of empathy for these things, to me, in some ways is striking. That I do talk to people every day, and they're focused on the reestablishment of the economy, which we are too. We have established, how we're trying to work to open up the economy. Or they want to know, what are we doing to provide basic food services and other things? All those things are critical. But if you don't have the human empathy to understand that this is about death and tragedy and heartbreak in people's families, then you miss the whole reason why we're going through this societal experience. And we hope to be a better society when we come out of it. I don't personally talk in terms of we're going to build bigger and better and all those things. That, that's fine. I think we're showing our resilience and our strength as a people that we get through this, that we survive it, and that there is, there is a tomorrow, and that tomorrow will be a better tomorrow, but not because we brag and say it'll be a better tomorrow. It's better tomorrow because we've been tested and found able to handle the test, and that we've been able to work through all of these different logistical issues and all these different stressful issues that affect us. Our number of active cases, our number of hospitalizations, the number of overnight deaths are all down. Our number of tests for COVID are all up. when we have more specific numbers and the grid every day, the map every day, we will share it with all of our friends in the press, and you'll be able to take a close look at it. We've also been tracking now the amount of antibody testing that we have conducted at the Westchester County Center and the interim medical facility that is there, both outside and inside. That was built by the U.S. Army Corps of Engineers to provide overflow hospital accommodations. At this point, the contagion did not reach hospitalization needs that required the use of those beds, but we are using that facility as a testing location for antibody testing to determine if people have within their system signs of the antibody that's used to defeat the COVID virus. And we've had now, including up to yesterday, over 2,500 individuals tested. We have targeted initially first responders from county government and municipal government, meaning local town, city, and village governments. We are now moving on to other workers within that world that may not be traditional first responders, but are essential employees. In a local government, your police, fire, EMS would be considered your first responders. Your DPW force would be considered an essential employee. These are people who you need them to work every day to collect the garbage and to do other such work, but they're not traditional first responders to an emergency. The county has those types of individuals as well in some of our key departments beyond police, corrections, the emergency services department, the probation department, and the public health department, such as our Department of Environmental Facilities. We operate sewage treatment plants. Those plants must operate. They must treat sewage. They must maintain public health and sanitation. Those men and women who work in that department are essential to us. And so now they are part of the testing cohort. We do not receive, nor do we reveal the number of positive or negative tests in the aggregate for presence of antibodies. That falls within the personal HIPAA law, because whether you have the antibodies or not, you are not contagious to somebody else. If you are contagious to somebody else, then there is a public need to know as to not whether, what degree of contagion has occurred. But we're very appreciative of the medical center for not only administering the blood test that's necessary, but also processing the test. And within a short period of time, 24 hours, those who've taken the test will know whether they have the positive antibodies or not. And this is a service that is being extended to all of our local governments so that each of them can be able to get some of their key people tested along those lines. Just to remind everybody that right now we're looking at state guidelines for reopening. They involve 7 categories that are critical: a decline in total hospitalizations, a decline in the number of deaths, a decline in the number of new hospitalizations, the hospital bed capacity, the ICU bed capacity, the diagnostic testing capacity, and establishing a contact tracing capacity program. And in at least 3 of these 7 indicators, Westchester has set records in excess of what most other places have per capita. We still, as part of our region, need to accommodate, need to achieve 2 more of these thresholds in order for the county to go on the list of those regions that can open. You're seeing that 4 regions of New York State are going to begin the opening process, I gather, this weekend, and they represent the great swath of upstate New York. If you had to color the map, the regions that are opening are the vast middle that's in between Albany over to Buffalo. And that great middle of the state, the more rural portion of the state, will open up according to the governor's guidelines. We are close in the lower Hudson Valley, and I assume some of the other upstate regions, the other 2 remaining upstate regions, are as well. We hope that that door will open. And when it does, phase 1 of the reopening will involve construction projects. It will involve manufacturing, wholesale trade. There'll be curbside retail and pick up or drop off. And then hopefully after a fairly short period of time, if the numbers maintain themselves, while that portion of the economy is open, phase 2 is a much broader area of opening. It will open all professional services, administrative and support. That'll be the sort of back of the house presence, finance, insurance, real estate, things of that nature. Many of the offices that we have in Westchester County for corporations that really drive our economy, that will open under phase 2. And then a little further down the line, phase 3 represents restaurants and food services, bars, and so forth. And then the phase 4, the last element of this, is broad-based entertainment, recreation, sort of the big community events in phase 4, and also education, K-12 education and higher education would open in phase 4. We'll see how the other portions of New York State function when they open. We hope soon thereafter we will be given that opportunity. I want to be clear with folks that each state has their own set of standards. And while New York has cooperated with New Jersey and Connecticut, New Jersey and Connecticut are operating with some different structures. And Connecticut will open more sooner than we will. And so we will see, for those of us who live in proximity to Connecticut, we'll see things happen and open up in Connecticut that aren't opened up in New York yet. And that may also be true for those who are familiar with being in New Jersey. At various times in my career, living in Westchester County, I have commuted into Manhattan to go to work every day. I've commuted to New Jersey to go to work every day. I've commuted to Connecticut to go to work every day. So there's an interconnection in the region that isn't just limited by the dotted lines of government. And so truthfully, if we really want to have a full functioning economy, it's not just based on our home county or our region opening up, a regional, Hudson Valley region, but it's the whole New York metropolitan area opening up, which includes New York City, which will be harder to deal with because of the concentration of population and a host of logistical issues that exist in the city. But we can't control what happens outside of our borders. We have to focus on the things that we should focus on inside our borders. And we're hopeful that all of these things will help as part of the process. I will note that the governor has announced that there will be some openings statewide of some functions that will occur from the 15th turning to the 16th. If memory serves me correctly, landscaping and gardening functions will be opened up statewide as an industry across the board opening. They plan to do something similar to involve what they consider to be sort of low impact recreation. We've done that already publicly with golf and with bicycling. They're going to add tennis to the list. They may have some others that fit into that category. And that statewide focus will help the process a little bit from a recreational standpoint for it to grow. But most of the decisions that are at hand are made by the governor. The governor uses his executive authority to show the right type of impact that is needed in order to justify opening an overall structure of the state. And it does make sense to do it on a regional basis. We do have the breakdown for today of some of our municipal situations. Active cases, as I've often said, always follow municipal populations. So Yonkers has 469 active cases of COVID, Mount Vernon 192, New Rochelle 187. And I want to dwell on New Rochelle for just 1 second. New Rochelle is where the original outbreak occurred, where the index patient lives, and where the first 100 or so people infected that were tracked all came because of close contact with the index patient. And when those numbers hit so quickly, people said there's an outbreak in New Rochelle as if it was geographically based, and New Rochelle was the center of the contagion. Well, as it's turned out, it's not the center of the contagion. It obviously, because it's a large city, among the top 10 cities in New York State in population, it still has a number of active cases. But while 2,788 people tested positive for COVID, only 187, which is a fraction of that total, actually are still with an active case within the 2-week period. Yonkers has 6,576 people have tested positive, but at the moment they have less than 500 cases. So I think that gives you a sense of how to judge the overall aggregate number, but really focus on the active number of cases, because those are the things that we have to deal with. With that in mind, the only other thing I just want to touch on is an update on census numbers. We get them every day. Westchester County is plugging along with the census. We are still ahead of New York State and the nation in terms of our total response rate, slightly ahead of the nation. We're at 59.5% of households. The United States is 59%, and New York State in the aggregate is 53.5% of the households. So we're ahead of that. We have 2 communities that have beaten their response rate from 2010, which was the last census, and that is Croton-on-Hudson and the town of Lewisboro. We have another 4 or 5 communities that are within a few percentage points of beating last year's rate. We hope every community will beat the rate from 10 years ago. We hope that every community will reach a higher level of percentage of response. A number of communities that hit in the 70s previously or in the 70s now, they have the capacity to hit 80% between now and October. And once we clear whatever the 2010 mark is, we have to push and try to get that 80% higher if possible. The communities that are doing the least well, we've been involved in local calls with their census committees in the last few days, and the work that they're doing to try to turn the tide there is essential and made difficult because of the contagion. You cannot interact with people quite the same you normally would. But we're monitoring the census every day, just as we monitor the COVID statistics, and we're hopeful that we'll be able to implement strategies, and that at the end of the day, we will record those number of people that are in Westchester County accurately. I believe that number is over 1 million. We'll see if I'm right or wrong, but it's more important that we get the accurate count than we win some sort of a contest between ourselves. So with that, I'm going to stop, go to questions. Appreciate your understanding and your time. Joe, what do we have waiting for us?
We got one from Catherine. She's got it.
We have one question from NBC. You already touched on it a bit, George, but they want to know, Yorktown is announcing measures for businesses to reopen, individually waiving application fees for outdoor seating permits for restaurants. Where does Westchester stand with meeting the 7 criteria for phase 1 reopening? And when do you anticipate we might reach those?
Well, the reopening, as I said, comes regionally, not individually by county. We've tracked our numbers, and we believe that we're substantively there. The one area we think is still a problem for Westchester County is the number of new hospitalizations. The governor has established a standard of no more than 2 individuals per 100,000 people in the population can be new hospitalizations on any given day. If you see Westchester as being 1 million people, 10 times the minimum number, then 10 times 2 is 20, meaning we cannot have more than 20 new hospitalizations a day. When we see a hospitalization number, we see an aggregate number, how many people are in the hospital right now. And those numbers have been dropping consistently. What we don't know is there a mix of people leaving the hospital that exceeds the list of new people coming in? And do the new people coming in come in at a level higher than 20 people in a night? And if they come in at a level higher than 20 people a night, even if we lost 50 people, the net result is we've dropped by 30 the number of people that are hospitalized, but we still have in theory, a high first-time hospitalization number. As those numbers continue, that seems to be the biggest concern, the biggest fly in the ointment. There is some concern over the number of deaths per night. And right now, I think that a fair bit of that can be corrected by reviewing some of the numbers and the way they were put together, and believing that we haven't been, properly tracked, at least on the night here or there regarding deaths. So if we can make that point, then I think those are the 2 demographic points or points that involve mathematics that will be the difference of us opening or not opening. Again, if we open in the first phase, it's pretty limited opening, manufacturing, wholesale, also construction projects and curbside retail. So people won't feel a huge immediate impact when the society opens. They won't see the local retail stores open. They won't see the restaurants open. And I think those are some of the key factors that look at people. But we're monitoring it every day, and we're doing what we can do to try to help make it open. And I'm hopeful that within the week we'll hit the number and we'll get to phase 1. And then within 2 weeks after that, we'll get to phase 2. And I think once we hit phase 2, which is the opening of all retail enterprises with certain protections in place that may not have been there before, then I think we're in a good place. Then I think we're starting to see the sense of the society is opening up. But we do it knowing that the only reason why we're doing it, or we feel able to do it, is that we still maintain a control on the level of contagion. We can't control the disease with a antiviral treatment or with a vaccine up front. So we'll have to control it with the way we manage people's access to it. And the less people that get infected by it, the better we are. Therefore, we can open sooner. I'm hopeful by mid-June, we can be open in a significant way. Maybe sooner than that if I'm, less optimistic than others. But I want the optimism to be based on reality, not based on desire. Any other questions that we have?
Nope, that was the last question.
Okay, very good. Well, we appreciate any questions you have. We remain open for those who want to call us offline. They can call Catherine Chaffee, 914-995-2932. And she and her staff will strive to get the answers to any questions you do have. And I'm certainly available as well, 995-2900, if you want to reach out, and we'll go from there. In the meantime, until we meet tomorrow morning for another Facebook Live program at 11, and then tomorrow I think we're going to be in Yorktown at 2 o'clock for this update. We want you to take care, stay safe, and we'll see you soon. I'm George Latimer, Westchester County Executive. Thanks for watching, and have a good day.